we're going to discuss drugs for diarrhea, by Professor Saminat and Kairahanam. This slide discusses drugs for diarrhea. Diarrhea is the symptom of loose, watery stool with more frequent bowel movements. It may be present alone or be associated with other symptoms, such as nausea, vomiting, abdominal pain, or weight loss. The most common cause of diarrhea is microbial infection. This slide explains through serial number, drug classification, and drugs name under the classification and mechanism. Number 1. Name of the classification, rehydration. 1.1 Intravenous rehydration. Drugs name under this classification: 1. Normal saline 0.9%, 2. 5% dextrose solutions, 3. Lactated ringers solutions. Mechanism of intravenous rehydration. Intravenous hydration process offers quicker and more effectively restoring water, dehydration, and electrolytes to the body tissues and maintaining fluid and electrolyte balance to prevent shock and death. Number 1.2. Name of the classification, oral rehydration therapy, ORS, new formula from World Health Organization, ORS. The ORS formula. Sodium chloride, 2.6 grams per liter, sodium, 75 millimoles per liter, chloride, 65 millimoles per liter, glucose, anhydrous, 13.5 grams per liter, glucose, anhydrous, 75 millimoles per liter. Potassium chloride, 1.5 grams per liter, potassium 20 millimoles per liter. Trisodium citrate, dihydrate, 2.9 grams per liter, citrate 10 millimoles per liter. Total osmolarity, 245. Mechanism of ORS. Through the process of osmosis, the salts and sugars pull water into the bloodstream and speed up rehydration. Sodium promotes the absorption of water from the intestine. Glucose to stimulate sodium and water absorption in the small intestine via a cyclic A, M, and P-independent process. Number 2. Name of the classification, antimicrobials. Drugs name under this classification: 1. Macrolides, erythromycin, 2. Cephalosporin, cefdina, cefpodoxime, 3. Fluoroquinolones, ciprofloxacin, levofloxacin, 4. Rifaximin, etc. Mechanism of antimicrobials. Antibiotics disrupt essential processes or structures in the bacterial cell to prevent bacterial diarrhea. Macrolides interfere with bacterial protein synthesis and, depending on concentration and bacterial species, are either bactericidal, kill bacteria, or bacteriostatic, inhibit the growth of bacteria. Cephalosporins kill bacteria by inhibiting the synthesis of peptide or glycan, provides stability to the bacterial cell wall. Rifaximin is used to treat travelers' diarrhea that is caused by a bacteria called Escherichia coli. Number 3. Name of the classification, probiotics. Drugs name under this classification: 1. Lactobacillus rhamnosus, 2. Saccharomyces boulardii, 3. Bifidobacterium lactis, 4. Lactobacillus casei, etc. Mechanism of probiotics. Probiotics promote a healthy balance of gut bacteria and prevent diarrhea. Enhancement of the intestinal epithelial barrier, increased adhesion to the intestinal mucosa, and concomitant inhibition of pathogen adhesion, competitive exclusion of pathogenic microorganisms, production of antimicroorganism substances and modulation of the immune system to prevent diarrhea. Number 4. Name of the classification, 4. Non-specific antidiarrheal drugs, 4.1 Absorbents and adsorbents. Drugs name under this classification: 1. Bismuth subsalicylate, 2. Aluminium hydroxide, 3. Aluminium silicate, 4. Methylcellulose, 4. Kaolin, 5. Pectin, 6. Activated charcoal, etc. Mechanism of absorbents and adsorbents. Enhance fecal elimination of the toxins or bacteria to control diarrhea. In the lumen of the intestine, adsorbents form a complex, bind up, attach to, with irritating substances such as bacteria, digestive enzymes, or toxins, and carry them into the feces. 4.2 Anti-secretory drug for diarrhea. Drugs name under this classification: 1. Anticholinergic, 2. Bismuth subsalicylate, 3. Octreotide, 4. Resveratrol. Decreases intestinal hypersecretion. It is indicated in the short-term treatment of acute secretory diarrheas. Anticholinergic drugs inhibit the postganglionic receptors of parasympathetic nerves that control intestinal motility. Octreotide reduces the secretion of pancreatic and GI hormones and promotes intestinal absorption, and decreases secretion of fluids and electrolytes. Resveratrol decreases intestinal hypersecretion by lowering mucosal cyclic AMP. 4.3 Antimotility agents. Drugs name under this classification: 1. Difnoxylate plus atropine, 2. Loperamide, 3. Codeine. Difnoxylate and loperamide both are analogues of meperidine and have opioid-like actions on the gut. They activate presynaptic opioid receptors in the enteric nervous system to inhibit acetylcholine release and decrease peristalsis. 4.4 Serotonin, 5-HT3, antagonists. Drugs name under this classification: 1. Allosterone, blocking the action of serotonin on the intestinal system. This reduces the cramping abdominal pain, abdominal discomfort, urgency, and diarrhea caused by irritable bowel syndrome, IBS. Thank you for your attention. Further information, kindly contact profsamiacademy@gmail.com. Disclaimer: this channel does not promote or encourage any illegal activities. All contents provided by this channel are meant for educational purposes only.